belief that a person can't change one part of their life without changing all of it. When you use the holistic approach to treating bipolar disorder, your role as a partner becomes as important as any member of your partner's healthcare team. The good news is that many people with bipolar disorder can achieve stability once they have a treatment plan that helps them prevent the symptoms that characterize the disorder. The key is to have tools you both can use to find relief from the ups and downs of this illness. This book will give you these tools. The correct diagnosis. Loving someone with bipolar disorder is not designed as a diagnostic manual, although diagnosis will be discussed to a degree in Chapter 3. Ideally, it is hoped that your partner has been diagnosed by a licensed psychiatrist, although nowadays many people are diagnosed by general practitioners or other mental health professionals who may or may not have the necessary skills to treat the disorder. It is important for you to understand that while some psychotherapists are qualified to diagnose or treat bipolar disorder, not all have sufficient training. It is important that your partner is evaluated by a mental health professional who specializes in treating severe mental illnesses. In other words, no matter who has diagnosed your partner, it is essential that the diagnosis be clear and correct. How to involve your partner. At first, it may be hard for you to get your partner to use the tools in this book. As you probably know, there are many stages to bipolar disorder. It will help if you are clear about where your partner is right now on a stability scale of 1 to 10. If your partner is stable and wants to do this work with you, then the optimum rating of 10 applies, and you can do the work in this book together. If your partner is in the hospital or is otherwise too ill to participate with you, then the minimum rating of 1 applies, and you can use the book yourself and introduce the new techniques when your partner is more stable. If your partner is somewhere in the middle, use your own judgment. It's highly recommended that you listen to the book and make the changes in yourself first, and then introduce them to your partner at a later time, especially if your partner is not well enough to do the book with you from the beginning. Crisis situations. If you are currently in crisis, that is, if your partner has left, is in a severe episode, is in the hospital, has stopped medications, or is refusing your help, naturally, you will use this book in a different way. If you are in this type of crisis, focus on yourself first and make the recommended changes on your own. Then, when things calm down, you can introduce the changes to your partner. If your partner is stable and you plan to work with this book together, celebrate. You have a great start. The reality of bipolar disorder. Always remember that although bipolar disorder behavior is frustrating and destructive, it's not purposeful, nor is its presence meant to punish you or anyone else. When someone is in the middle of a mood swing, compassion goes a long way. It helps to keep this in mind as you begin working with this book. Loving someone with bipolar disorder is not a quick fix. It's easy to be hopeful and excited about something new, but when it becomes difficult, or your partner does not respond immediately, it's also easy to revert to old patterns where you alone must do everything to keep your relationship together. Or maybe your partner is too ill to respond. If that is the case, or if your partner is under extreme stress, or their thinking is distorted, they may be unable to do the work. Naturally, this will frustrate you, but you are not alone. At first, many partners of those with bipolar disorder must do the work by themselves.